right now have 33 people on the call. It's a beautiful night, so I'm not surprised that we have a few less than we normally do, but that's still a good group. I'd like to introduce all of you to Dr. Eric Statt. He is a doctor of kinesiology. Am I correct in saying that right? Mm-hmm. And he is a professor at Lake Superior State University in Sault Ste. Marie. And he is going to talk to us about movement and Parkinson's and some practical things you can do at home. Okay? Mm-hmm. Give you Dr. Statt. Thank you.
Hey, thanks. And again, I'd like to say thank you to the Michigan Parkinson's Foundation, Mary Sue, you and Emily, and for inviting me tonight. It's a joy to be able to talk to some people. Honestly, I'm used to being surrounded by people at the university, and right now I'm a little cabin fever, like I'm sure everyone else is dealing with just a little bit.
Yeah.
I'd like to start out our discussion tonight and just give a little bit of background about myself. I provided you guys a set of notes that I think can be forwarded on to folks that have information from the talk tonight. But prior to that, I'd like to walk through just a little bit of my background so that the people that are with us tonight can understand kind of where my bias is, where I come from in terms of this discussion.
If I can turn it up.
So basics in my background are that I am an exercise physiologist. I'm also the chair and an associate professor in the School of Kinesiology and Behavioral Science at Lake State. I work with a group of people to deliver the kinesiology curriculum. Specifically, the things that I teach are exercise science. So my major focus is exercise physiology. Assessment and prescription is a big part of what I do, but I also teach a lot of classes in exercise science, things like motor learning, nutrition, strength conditioning, those kind of things. My background started out in physical education. So that's kind of the important piece here. The things that I like to focus on that I talk about are really the application of exercise science theory. What do you do? How do you do? And so with that, another piece of my background that plays into tonight's discussion, and I think what got me involved with the group in Sault Ste. Marie, my mother-in-law has Parkinson's. And so that's been something that as a family that we've centered around and rallied around. And we've spent some time, obviously, in working through the process of living with Parkinson's with mom. And so my educational background, it was in exercise physiology and epidemiology, public health, but I started in physical education. I've also spent a portion of my career, about 15 years worth, running large fitness centers, large health clubs. And in that process, I was a program director. So my job was to create programs that would be attractive to keep people engaged and also to keep people working within the club setting. And then, oh, there's Emily, right? And working within the club setting and using the program base. We had a pretty diverse population. I've worked in different types of facilities and have been really fortunate in the experiences that was able to afford me prior to finishing out my education. For fun, things that I like to do is I'm a backcountry camping fisherman, and I like to golf. I picked up golf recently, and I'm really enjoying that. So activity and being active in one's life, that's a big part of my background, both educationally and also in the things that I like to do. Oh, and along the way, I also like to coach some soccer. I've got a thing with athletics. So I was asked to come in and speak tonight just about how to stay active and some of the things we can do in the home. But as any good academic would do, I like to set the stage a little bit with some of the background information that we have around Parkinson's, but specifically how it expresses itself and, there we go, how it expresses itself and what we can, oh, hang on with me just 1 minute. I lost my notes on that. Let's see here. When we went to screen share, the notes that I had popped up, hang with me while I just switch my computer view.
Dr. Statt, can you see what I put up there? I shared your notes.
Yep.
Okay.
We can just pop through this and we'll just scroll through.
Okay.
Let's see if I can view options.
Tell me when to scroll, okay?
Okay, that's great. So background, that's awesome. You'll be able to keep up. I'm pretty conversational with this kind of stuff. So Background. When we're talking about Parkinson's disease, it affects a lot of people, and I would assume that all the people here are either dealing with this on a personal level, or they have a loved one, or they're a clinician who is working with individuals who are addressing Parkinson's disease. So when I looked at the prevalence across national numbers, we're looking at about 1.5 million people, and it seems to be that about 70,000 new cases are diagnosed every year. One of the things that makes this a particular challenge with exercise, of course, is that this results in motor function and motor dysfunction that can really make some challenges with movement. The major culprit, as we look at the pathology, is the neurotransmitter dopamine. And within that, there's a mid-region of the brain that is called the substantia nigra region of the brain that is particularly affected by the lack of dopamine. And over time, you can actually see in slides the reduction of mass in that area. And so within that, one of the big challenges we have from a diagnostic angle is that we really we're really unsure about what the exact causal pathway is. We're able to dial in on some things. A couple of the potentials are genetics and environment, but there does seem to be a particular relationship to aging and gender. And in this case, men seem to outnumber women on about a 2-to-1 scale. And then the average age of onsets occurs between 60 and 70 years of age. So when I started looking into these numbers, one of the first questions I had right away was, this is also going to be dealing with a lot of reduction in functionality in people in terms of exercise and activity, simply because of the aging process. And that does appear in the literature as well. That seems to come out in the scientific papers when we look at it. And then the last piece that I would want to mention is that makes this really tricky is that Parkinson's shows itself up in really individual ways. There's a lot of variability within people as it relates to how the symptoms show up and when they show up and their severity. So when we're looking at the diagnosis, there's really no specific biomarker that we can look at. So in the diagnostic problem or the diagnostic process, that creates a challenge specifically because by the time we start to see symptoms, which are the best tool to diagnose Parkinson's, the average is about 60% of degradation to that component of the brain has taken place. So in other words, we don't really have a great diagnostic tool that would allow for possibly some more preventive type care, some prophylactic care, some things that we could do that might mitigate that onset. And that was something that I saw personally with my mother-in-law. Once the symptoms started to appear and the diagnosis occurred, on one hand, it was a very beneficial thing because we could start a treatment plan. Secondarily, the challenge is that it accelerated at a reasonable rate. The last piece in the diagnosis that I thought was of interest and of note was in epidemiology, when we look at assessment, and we're all seeing this now with the coronavirus, one of the things we look at is how good are the tests? And the way that that's measured is by the ability of a test to do two things. One, when it says that the test is positive, that's accurate and that you in fact are positive with the condition. And the second would be when the test is negative, that is in fact accurate. A false negative is particularly troubling because usually people won't go and follow up on it. Where a false positive, you'll get a second opinion. In this case, Parkinson's has, in some cases, around a 25% false negative rate, meaning that there are other conditions that show up with the same symptoms, and that becomes a trick in the diagnosis as well, and that can delay diagnosis. So when we look at all of those things, once someone has the diagnosis of Parkinson's, it's really important that we look to establish a regular pattern of activity and movement to see what we can do to offset any rapid development of symptoms. So, specifically about movement. Parkinson's shows up in 4 specific symptom patterns. The first is bradykinesia, which is a slow movement pattern. That really has impact in individuals' activities of daily living and reaction times. The second is the classic symptom of a resting tremor. I found it very interesting that the research supports that intentional movement and focus can decrease resting tremor. And in the folks that I've spoken to here in Sault Ste. Marie, they've also backed that up and said that that is an effective thing for them. Concentration and pattern seems to be effective. Rigidity, which is basically what most people would recognize as tightness, tight muscles. And then postural instability or balance. That really creates the most major concern that I've seen in the text and stuff around exercise for PD, which is falling. The biggest fear is, of course, putting people in a safe position. We can go ahead and scroll. So, other things that go along for the ride on this. We have some motor things or movement things, and then we also have some non-motor things. And this kind of wraps up the idea of what are the challenges that one has before we start to look at how exercise can be a part of the management. So we've just walked through the 4 things that are symptoms that show up in terms of movement, but there are some other things that are specific that show up, like gait, postural freezing, difficulty with facial expressions, flexed forward posture, which can create some muscle imbalances. Other things that go along that are non-motor, cognitive dysfunction, fatigue, depression and sleep can become a challenge. And then autonomic stuff, which is basically all of your body's automatic processes. When I was reading this, what struck me is that when I put that entire scenario together, when you look at it from a movement standpoint, it's a really challenged, and I don't mean to be euphemistic or minimizing, but that's the softest way I could say it. It's just really, it's a real challenge. It's got a lot of unique and difficult things that have to be overcome. What's really cool about it though, and I think the good news, and I always try to point to the good news when I'm talking to students about things like this, is exercise, once again, kind of shines through as being something that really helps to mitigate and to slow down the progression of the disease. So benefits that are specific to this, we can go ahead and scroll. If you look at this laundry list right here, and what they include, I don't want to read through them, everybody can take a look at those, but of all of the list of things that I just went through, almost every single one of those is addressed with exercise. Now, at the end of this document, there's a list of academic resources, and I included those academic resources in case there were clinicians who were interested in following any of these claims up. But there are also a tremendous number of online resources that are available through the Parkinson's Foundation, the National Parkinson's, Michigan Parkinson's Foundation, that support these as well, that give nice summaries to this also. But if you look at the list, one of the things that I was encouraged about was that the efficiency of dopamine is improved. So exercise seems to take what's left in terms of our ability and make it more efficient and more able to be used. And then that follows with all of the physiological systems like nervous, muscle, motor learning patterns, all of those things are improved, balance, coordination, and then also the psychological metrics, the things that we talked about. So there's no way to talk about these conditions without taking into effect the psychology. And so in that, the research on exercise and psychology is really positive. It's a different topic for a different day, but it goes hand in hand with what I was reading about exercise interventions for Parkinson's management. And then when we start talking about just the everyday benefits of exercise in terms of feeling better, being able to do things at a higher quality, not feeling fatigue, personal relationship improvement, all of those things really play to a quality of life. And I think that's a really important, from my point of view, maybe that's the whole key in all of this, is finding the best road to the best quality of life we can have. So there's a bottom line statement here, basically, that goes along the lines of this, that managing Parkinson's is difficult. The symptoms, the way it expresses itself, and the impairments are real, and they tend to work together to become exponential in their challenge. Exercise has shown to be very beneficial in mitigating those and improving the quality of life and the activities of daily living for individuals who participate in that. Now the question becomes, well, what do we mean by exercise? And then what exactly is the process to see those changes? Can we go ahead and scroll? Isn't that a nice symbol there? Did you guys see that? Lake State. I got to just do a shameless plug here for Lake Superior State University, that school of kinesiology. So there's my shameless plug. All right. So who can benefit from exercise, and what exactly is exercise? So the first thing that I want to tell everyone who's with us this evening is that everyone can benefit from exercise. Now, I recognize that on the spectrum of functionality, that there are individuals who have high function and individuals who are not going to have as high a function or have lower function. But within that, if you look at the idea that exercise is really nothing more than a way to compartmentalize movement, everyone has levels of movement that they can participate that can be beneficial to them. It is obviously better if an individual can get an early diagnosis and start structured movement and exercise early in the process. But even if they did not, there are still methods and things that we can do, all the way down to things like working on respiration for easy and breathing using a spirometer. There are a number of things that we can do that can make life just easier every single day. Although, in fairness, what the research seems to show us is that it takes a couple of very important details. One, it has to be very intentional. And two, individuals have to try hard. Simply going through the motions of movement will get some result, but in order to improve the results, just like anything else, the more we put into it in terms of our focus and attention, the better response we're going to get. So the bottom line on exercise and participation is essentially that everyone can benefit from it. The more function that we can put into it, the greater the benefit. However, when we're talking about quality of life, it's really dealing within the spectrum of our activities of everyday life, the things that we have to do. So how do you define exercise? So exercise and activity are different. Activity is something that we do throughout the day. When we get up and move, if we go to do something in the house, it's typically unstructured and unplanned. What makes exercise unique is that it has those two components, structure and planning, but that there's also a specific goal or outcome. In this case, it might be something like increasing or improving range of motion to assist with getting up and out of the chair to maintain walking around the home. And it might be an approach to focus specifically on maintaining the range of motion. Or it might be on strengthening the upper body so that we can continue to use a walker or to be able to do dishes or whatever the things are based on our progression. So those two things, structure and planning, and then goals. So if we look at that, basically from a very simple model, we can break down activity into some pretty basic patterns. And on the list in front of you is are these patterns: push, pull, squat, rotation, and balance. So one of the things that I do in my teaching is I teach sport science. I spent my life in sport. It's where I come to this. I came through physical education. I've been a coach. My academic side has dealt with public health and dealt with exercise physiology. But when we teach even the top athletes how to train and the things that they have to do, we use these very same terms: push, pull, squat, rotate, and balance. If you think about movement, like in this case, walking is simply a combination of those movements right there. So that one of the things I like about that model is it makes the process reasonably simple to think about. We push things, we pull things, we use our lower body to get up and down, we rotate, and then we have to do it all on balance. So what makes exercise unique is that we then break that up into these ideas of getting stronger, improving our cardiovascular system, we can improve our flexibility, and then something that I'm a big proponent of balance. Balance becomes a major issue as we age. It also is probably the most ignored thing in all movement, is that movement is always made easier if we're more efficient. Just like any machine or any system, the more efficient we are, the better it moves. So if you take those ideas, we can apply that. You start thinking about my claim earlier that everyone can benefit from exercise. Well, at some level, we can approach these movement patterns, and we can also approach these ideas. The real question becomes the creativity we use in trying to do that, which is kind of what the backdrop to today was. One thing that I would want to continue to emphasize, though, as we go through this, is that everyone is going to be at a different stage in progression, and that's going to have a dramatic impact on how people, the choices that they make around what type of exercise and how they approach that. We can go ahead and scroll. So you're going to notice on this table is basically just takes what I was just talking about, and it breaks it down from the point of view of types of exercise. So again, we do balance exercises. I list that first because I really believe that's the basis of everything that we do, and it is particularly beneficial in working with PD. Resistance exercise, which is essentially just muscle strengthening. Cardiovascular exercise, and in this case, not just for aerobic gain so that your heart and blood vessels work better, but also because cardiovascular exercise is often movement-based, and it includes big endurance strengthening components as well. And then flexibility. And one of the things I would mention around flexibility is the comfort factor. Maintaining flexible range of motion, being able to move through space, fighting that rigidity, that's going to go a long way to the everyday aches and pains that we feel. So examples of these things, let's run through some of those. Okay, so a point about bias. Exercise, when I started as a young guy, exercise to me meant going in the weight room, running. I was a jock and I was an athlete, and that's what all those things meant. And I started out in physical education, and I had this very good teacher. She was amazing. Her name was Elena Plummer. I mention her name simply because she was so impressive to me and so important. But she was a physical educator. And one of the things that Dr. Plummer insisted on teaching me along the way was that exercise was really just taking everyday movement and breaking it up into its parts. And that if we can maintain movement, if we can do things that we enjoy, that's the best exercise of all. So if you look at the list, right out of the gate, if there are things that you enjoy that are recreational pursuits, I cannot encourage you to do that anymore. I beat on that drum all day long. Find the things that you like to do and do them. And don't be apologetic for it. If you enjoy dancing, dance. If you like to walk, walk. If you like to do scrapbooking, whatever it is, if we can add movement to it, that's the trick. But people tend to not do things they don't like. And so there's a double negative there. If you don't like something, you won't do it. And so most people, treadmills, lifting, things like that, I found that I was unusual in that. I was trained and I enjoy that. But for most, and as I've gotten older, absolutely not. Backcountry camping, canoeing, golf, those are the things I really enjoy. I still spend time on the bike, but that's a force of habit. So you're going to notice walking and biking. Now, bikes in a home, there are so many bikes and so many bike options. I've shown a couple that you'll see on the page to follow. There's a couple of different pictures, but ergometers, bikes, those things are available and they're a great tool. Also, any group forms of exercise. Now, I recognize that we're all under stay-at-home orders and we're all working hard on that. But as this starts to clear and as you start to feel comfortable, or if you have people in the home, group settings offer, I think, a really great way to engage and to just make that time go by and just more pleasant. Most importantly, whatever it is that you choose to do for movement, one of the key here is that within it, to practice movement strategies. And by that, I mean, if it's something like in the house, I'm going to vacuum. And so within vacuuming, if I know that I need to work on stretching my upper body, I might add that upper body stretch to a vacuuming session, or I might add some form of my movement therapy or into what we're doing that day. A little bit of thought goes a long way to incorporating these ideas. So if we take exercise, we focus on those short lists and we include it in activities, things we do every day, fun, recreation, it can go a long way to taking the scary word exercise and making it a lot more palatable, something that maybe a little more willing to do. There are some considerations of when to exercise that I want to talk about, some safety considerations too. So obviously, out of the gate, when there's a Parkinson's diagnosis, medical treatment is often one of the very first strategies that are developed, and medications are given. And then the question becomes finding the right fit with the right titration and making sure that that's working. So if one considers that people react differently to medication, and then also that they react differently to their progression in the symptoms, and then day to day, finding the right time to exercise is really important. So the way that I saw this described that I thought was best came from the American College of Sports Medicine. And they described that time in an individual's day when their medication is on. In other words, when they're at the peak of the medication doing its daily function and having its acute treatment. So finding those times in the day when people feel best, that is the best time then to perform that exercise. It's also the safest time. Beyond that, also being aware of the side effects of medication. So the ability to adjust your daily goals based on your medical and medication interactions, that's a key in this process. And it gets kind of common sense. If you feel good, that's a good day to pursue. If you don't feel good, then back it up and regress that process. That's different than being committed to when I feel good, I'm going to give it my best day. Giving it your best day is an important thing to do every day, but it's important to also be aware of if I'm having a good day or a bad day. And on bad days, it's okay to relax it, but when you relax it, you still give it your time and attention. That seems to be one of the major focuses within the literature, is the time and attention to the detail of the exercise itself. We can go ahead and scroll. So exercise absolutely works with activities of daily living. It's really important to focus on when are you at your best for the day, what's your personal level of readiness, and then breaking it down into the simple ideas of pushing things, pulling things, squatting our lower body, which is absolutely important, and then balance. And balance, squatting, pushing, and pulling, those are things that can be incorporated in the things we do all day long, as long as we're aware of them and we pay attention to those ideas. Go ahead. So the last part of our discussion before we jump into some questions is this idea of how to exercise. And I grappled with this a little bit because how to exercise is a very detailed question. We've got multiple classes that we spend with hours and hours to teach students these various ideas and details. So what my approach was with this was to kind of set up some discussion points, to offer some resources, but to give some things to really consider. There are a lot of resources available. If you're interested in pursuing a personal exercise prescription or personal approach to your exercise, I would be remiss to try to give too much detail without having more information or being able to spend time. However, there's really some basic guidelines that we can go through that I've accumulated here and pulled together for you all. So the table that we have in front of us is a repeat of the table that I pulled up earlier. However, I've added just the idea of what creates risk around that. So for instance, with bradykinesia, the problem is reaction time. And reaction time can increase the risk of falling. So slow movements, if you thought is to move and then your body doesn't respond as quickly, in terms of how your body works from a motor learning standpoint, that can create signals that cross up, and that can create issues with falling. For instance, Tremor, one of the things that can go along with a resting tremor is your grip strength. It's important on days when hands don't feel right to be aware of grip strength so that if you're lifting something, it doesn't just drop. Rigidity, that's the ability to move. Tightness, that can really affect range of motion. And then of course, instability, balance, and I think that's self-explanatory. That really comes down to falling, maintaining a safe, stable balance no matter what we do. So, things that can help with this. This is an area where I had a lot of fun when I worked in the fitness industry. I was responsible for helping individuals to make purchases for their home, and our trainers did a lot of this, and our goal was to help people to become self-aware and to have resources in front of them. The first set are a set of walking sticks that my wife and I use. These are really popular. They can be used in a number of different ways. In working on balance every day, that makes sense. We balance every single day. Correct posture is a big part of balance. Sometimes, especially with a lean forward position, that can be difficult to achieve. So from a function standpoint, as well as a safety standpoint, I find these Lakey poles, and there are a number of different brands. These poles are really super. They started out as working just like cross-country ski poles, and folks in Scandinavia used them to walk during the warm weather. They make for a tremendous aerobic exercise tool. You can use them just like ski poles. They have rubber tips, and you walk along and they increase your rate of exercise. They're really great that way. But the big benefit I saw for a lot of people is that they're also super for doing balance exercises. So you can put them next to you so you keep the wobbles out. And then I just showed something that from a company I just went online and looked at from Appliances Connection. And this was a device that was used just that was taking the poles one step further. But again, if you take a look at the model, you're able to see that she's able to maintain an upright posture, which is very beneficial. And then the last picture, of course, stability balls. One caveat about stability balls, I have watched many people bounce off of stability balls. So just be aware. But if there's something that you're comfortable with, just by sitting on it, it engages your core and you have to sit upright. I'm even slouching in my chair as I speak to you guys tonight. But the stability ball forces you to engage your midsection, and that just does work on your posture all the time. And that's a real benefit. And then there's a couple links there. There are a lot of companies out. So strength stuff. Tubing. Tubing is really great. And now, tubing comes in different ranges. The smaller a diameter, the lighter it is. The heavier diameter, the heavier it is. They even make tubing that's used with maximal strength power lifters. And you should see these things. They're big enough to pull a Ford pickup. Okay, but for our purposes, what we're really talking about is either theratubing, which comes in big rolls. And you can see in the picture in the group class, that's what we're looking like. Physiotherapists and physical therapists use this all the time. But you can also get preset tubes. I'm going to grab one. I meant to grab this earlier, this thing. You know, these are great. You can use them to push, you can use them to pull, use them for your back. They're amazing. You can put one on your foot and you can do arm curls. You can put something over, you can push down. So when we're thinking of pushing, pulling, squatting, and balancing, a simple device like this, which is about $10 online, and you can do all sorts of stuff. Now, caveat with this, posture is super important. So what we don't want to do is just grab it and start yanking on it. But once you learn a couple of postural cues, working with it can become really simple and very effective. Use it in a lot of different ways. The link that I shared with you there is a company that I've ordered things through for well over a decade. There are probably 3 or 4 others. That was just one that I grabbed. I went online and pulled that specific to take it to their website. Again, you'll see in the group class the use of hand weights. So things that you might not know, a can of soup is a pound. Okay, if you look at how many ounces it is, it weighs about a pound. A bigger can of soup, about 2 pounds. A gallon of water is 8 pounds. Half gallon, 4. So we start looking at those things. There are a number of very standard issues in the home that we can use to work on strength. Cardiovascular. So caveat with cardiovascular. Cardiovascular in balance exercises are probably the two places where falls are most likely to occur. So with that said, that's because they also challenge the best. So cardio, if you think about it, is things like walking and biking. If you have higher level of functionality and ambulation, then walking is obviously the number one thing that we're trying to do all the time. We want to maintain walking and squatting. But if there are days where that doesn't work as well, you can see that there are a number of devices that can be used that can increase balance. So again, the walking sticks that are there on the left side, but they also have some really reasonably priced at-home ergometers. And an ergometer is nothing more than a gear wheeled mechanism. So in this case, upper and lower bike. Okay, so you can see this young guy and he's on there, but that device is very simple to use and can really help with maintaining the function of keeping your ankles, knees, and hips moving, which is really what cardiovascular can assist in doing. Should you go and look for a fitness facility, I included a piece that is called a recumbent. Recumbent means seated. A recumbent stepper. If you're going to look at any fitness facilities and you look at their cardiovascular equipment, you should ask them about recumbent steppers. They're a very popular device and they work really well. They're very stable and they really help maintain range of motion, plus maintain heart rate and blood pressure and all of those things as well. And then the last thing I would mention, again, under the current conditions, this might be more challenging, but as we come out under restrictions, YMCAs, any local community centers often do aqua classes, and they'll often do classes that are very specific to individuals with movement disorder. And so I can't recommend that strongly enough. Aqua is really, really great. Probably some of the hardest workouts I've ever had in my life were in a deep end of a pool, put through those. And then in specialty classes, they really are supportive, and you do it in the lower end of the pool and they can really help support, maintain balance, no falling, and they're just a lot of fun. So if those are capable or you have it as an option, a YMCA, those are great options too. And then with flexibility, again, bands can be very useful. And then really what we're looking at is at-home stretches. The nice thing about flexibility is much of flexibility can be worked on at strength from a seated position. And for individuals who are having a bad day or they're feeling shaky on their legs, this really allows them to focus on stretching without having to be too concerned about the balance issues that can go along with that. Now, I've included a couple of words here consistently to include medical practitioners. That's strong advice. This condition shows up different in individuals so much that to exercise safely, it's really important to have people on board. But there are also some really good online information sources, and I've included one there, Parkinsons.org, and then I've also looked at the Michigan Foundation, the National Foundation. There are a number of great resources online that can show different stretching and specific exercises that can be helpful. And then just a list of additional tips. The biggest thing that I can recommend is, one, exercise is beneficial. Understanding what exercise defines for you is personal. I always am careful I don't really like the word exercise because people tend to picture weight sets and treadmills. But in this case, I'm talking about things like planned, structured recreation. Now, within that, it's really important to understand your limits. Safety it's more than important for a number of reasons, but from an exercise standpoint, what makes exercise work is that it's consistent and it's applied all the time. It's not so much that you're going to change the world in one day. It's that we continue to be disciplined and make our body move, especially in conditions that don't support movement. So knowing our limits and respecting those limits is very important. If you can find a fitness facility, look for specific equipment and ask about specific equipment like recumbent steppers and pool classes. Groups are great. Whatever you can do, whether it's in groups or fitness facilities, consistency. Consistency is key. Being intentional means to focus on the idea And what I find with being intentional about exercise, one of the great things that works for psychology is just that when I am thinking about what I'm doing in terms of exercise, I'm not thinking about the other things that are troubling me or that are pressing. I'm focused on what I'm trying to do to improve a task. And that's a very simple thing to do, but it's also clarifying. I find that for me. And then in terms of intensity, on good days, work as hard as you're comfortable working. Okay? Now, we don't want to go too far or press too hard, but your body will tell you. At the same time, I find that with motivation, it's easy on days where I don't have motivation to kind of back off the gas a little bit and not try. The thing that'll make the difference is consistency with intention and trying on those good days, making sure that we give it our best effort, but respecting what that effort is on that day. The research around it's really fascinating, though. I don't want to go any further with that idea on another day maybe, but I was really impressed with the research that people have done at looking at high intensity workouts, with meaning workouts that stress strength and make your heart beat really fast. With Parkinson's, they've had great success, and I think that's really encouraging. And then the last couple of pieces that I would say is to really focus on balance and flexibility. Those are the two things, being able to move. Once we're able to move, then we can work at being stronger when we move and more functional when we move. But strength and cardiovascular, those kind of things, they don't help a whole lot if we can't maintain balance and we can't maintain that range of motion. Those are the kind of the foundations of everything that we're doing. So even on days where I'm not feeling so well, balance work can be done, posture, sitting up work can be done, holding our core can be done, working on range of motion can be done. All of those things don't require your best physical day. And then kind of to summarize the idea, I think that's where we are. Yeah. If one looks at quality of life, if one looks at activities of daily living, and if one examines what is the purpose of exercise, exercise is really nothing more than ways to break up activities to make our activities of daily life more functional and more enjoyable. When we do that, it affects our quality of life, it affects our psychology, it affects our relationships, and all in positive ways. The other thing, whatever support mechanism that you can generate, be they family, friends, or medical practitioners, any support, make them aware of your efforts and have them participate in that process if they're willing. I find that for anyone on days that aren't high motivation days, having people around that can help out with that process, that goes a long way. And then the last thing that I've shared with you is just a series of academic papers that I pulled this information from. That's the reference list at the end if you scroll down. And you know, but for much easier reading than this, the Parkinsons.org, the National Parkinson's Foundation, Michigan's Parkinson's Foundation, there's a number of great resources that are out there. All right, guys, my monologue's done. Ask me some questions.
All right. It's unmuted, everybody. The best way to answer questions, here, let me unshare this really quick.
I can't listen to her.
Can you unshare it, Kelly?
Do you have a question?
Oh, here's stop share. Okay, there we go. Maybe the best way to ask questions is if you all see the chat line at the very bottom, you can type in your question there. And that way we won't be talking over each other.
I do not see a chat box.
It's at the very bottom of the screen. If you take your, I don't see any questions yet, but if you take, just hover around the bottom or maybe the top of the screen, do you see something that says chat?
All right. You don't want anything.
Gallery, oh, there we go. Type your questions here.
Yeah.
There we go.
Okay. Anybody have a question? And if you're not comfortable using chat, it's pretty quiet. Go ahead and ask.
There's something there.
Pardon me?
There's something in the chat box.
You can go ahead and just ask it verbally.
Dr. Statt, Hetty Mulvang, Traverse City, I'd like to congratulate you on your PowerPoint. It was very readable. It was efficient in explanation, and it even included the resources, and I'd love to get a copy.
I'll send it to you, Hetty. We can send that to you.
Good.
I wasn't sure. I spent a lot of time talking to college kids, but yeah, no, I appreciate that. That's good to know. I feel better now.
Would I like a
oh, pickleball.
What was the question?
The question is, what do you feel about pickleball?
Oh, okay.
Pickleball's fantastic. It's a great game, and it has taken off in popularity. I started out when I ran those tennis clubs. And so I ran the fitness division within these big tennis clubs, and pickleball took off, and what a great game. Hand coordination, balance, fun, appropriate levels of movement. Yeah, just fabulous game. Again, readiness and just making sure that it's a decent day and a good day.
tennis,
If you can maintain those kind of activities, that's outstanding.
like tennis, but it's got a waffle ball.
Yeah, and it's played on a smaller court inside a smaller space, and yeah, and I mostly playing doubles, isn't it?
Yeah.
Yes.
Yeah, it's a fun game.
I got a private question someone sent me. They want to know how much exercise is necessary for a benefit.
Okay, so the standards on exercise work like this. We break it up into moderate or vigorous. Moderate is where you hear 5 days a week, 30 minutes a day, okay? That means 150 minutes a week. When it goes to vigorous exercise, it gets cut in half. It's 75. So when I talk to people about this, counting minutes is kind of a drag. So what I'll tell people is this: our bodies were meant to move every day. Every day we probably do activities, but twice a week we do muscle strengthening exercise. And so muscle strengthening exercises include lifting, pushing and pulling things, squatting. And then every day we should be working on continuing to do walking exercise, any sort of ambulation or ambulatory exercise, biking, any of those things. If you think about it, if I told you it was okay to go out and walk around the block and take 30 minutes and go for a walk every single day, most people would agree with that that's not problematic. It won't cause injury. There's no issue with that. That is a really solid approach to getting exercise, is just to make it an everyday event, but a couple of days a week, make it more strenuous than others. So we describe, the last bit on this is there's an easy acronym. It's called FIT, F-I-T-T, frequency, intensity, time, and type. Frequency, every day, walking, moving around, twice a week, strengthen. Intensity, every day, moderate, twice a week, harder. Time, 30 to 60 minutes a day of movement. And then type, things that we talked about, things you like.
Okay. Thank you. Do we have another question?
Just a comment. I'm doing the rock steady boxing, and I find that very beneficial. Obviously, we're not doing it right now, but every week our coach is sending a different workout, and so she's keeping us doing all kinds of squatting and all, pushing and pulling and things with weights and all of that. So that's been very helpful. If people aren't familiar with that program, Rock Steady Boxing, when all of this is over, it's a good one to look into.
Rock Steady Boxing, I think it's called.
Yeah, if
Is
you
it
look
you,
at the
Sue
movement in
Pretty?
boxing,
Yes?
Hi. Hi, Sue.
Hi, Mary Sue.
Sue. Good to see you.
I can't see you.
Can't. Oh, I thought I was.
I can see 5 people across the top. That's
all right. I'll put us in. Here we are. There I am. Okay. Do we have another question? Hi, Carol.
Hi, Mary Sue.
I'm seeing all my buddies.
Do you have a recommendation what time of day is best, or do you think we ought to change it around and work out sometimes in the morning or sometimes in the afternoon?
The recommendations, I'll give you two-part of a recommendation. One, if medication makes a difference in how you feel during the day, then that's the major determinant. So the recommendations that I read about, the things that I've studied, indicate that there's a particular time when medication is most effective, and that's when exercise should be planned. If you don't have sensitivity to medication like that, if that's not the issue, then medication or then exercise in the morning or times when people are most rested is probably the safest. It also, the research supports it as being more effective. They're not quite sure why. I tend to think it's because morning exercisers are disciplined. If you do something in the morning, you got to really want to. But in terms of dealing with it from a clinical standpoint, the first focus is when you're at your peak for having medication, having it be effective.
Thank you.
Certainly.
Okay. And any other questions?
Dr. Statt, do you recommend music?
I do.
Good.
What music do you like?
Oh, I'm across the board, actually. I do sing jazz.
Do you really?
Yes.
Wow.
Well, I'm not going to ask you to do that because I don't want to embarrass you. But
Oh, and
You won't embarrass her.
big fan. So you're going to give it a go?
Go, Hetty.
I think music is so important because it operates 5 areas in the brain, and for Parkinsonians, it exercises those muscles because, and I want them singing out loud. I want them to bounce off the wall. I finish my meetings. I'm a facilitator, and I finish the meetings with a song, and I want it to bounce off the wall.
Oh, neat.
Oh, that's great.
They love it, you know, and I always fall back on Cohen's music, you know, I'm a Yankee Doodle Dandy. You know, that's patriotic and it's moving.
Oh, yeah, and it's coming into the right time of year.
Absolutely.
Right.
In the world.
Right.
Just got to
Right.
take care of it.